My name's Allie, and we're going to tell you why nurses help people. They give shots to people that need it. They comfort families that are sad.
All right, so I'm Aubrey. These are my two little sisters. They are going to be 8 this summer. My mom had them when she was 54 years old, and they were born 10 weeks early. She found out when she was 6 months along in the pregnancy. So it was an exciting time, but scary due to the risk factors for my mom and these two. It was the summer before I left for college, about 3 days before that they were born. So they completely shaped my future and life as a nurse. They created my philosophy, which is to really put family first and to take care of them holistically and to provide care and comfort when family can't be there, to do the hard things and to support the patient if something's too hard for families to watch or to have those difficult conversations with them. It's to be an advocate when they don't feel like they're being heard. It's to be there and be present for them when they don't feel like they have anyone else to listen to them. My nursing philosophy is, and healthcare philosophy is to use the best evidence-based practice we have, and it's to advocate that the patient use it, but if they don't want it, to not force it on them. Healthcare is a quickly evolving field, and the philosophy of it is to keep up with it and really make sure that I am staying up on evidence-based care, as well as providing individualized care for my patients, and speaking up for myself if I feel like patient loads are not appropriate, uh, and really just being a a person that and a provider that people I take care of can lean on. Um, it's more than dispensing meds and everything, but it's doing all of our daily tasks safely and efficiently, and really just being able to provide quality care um, in situations when families are at their worst, when people are crabby, but we are able to look beyond that and know that it's one of the worst days of their lives, and we are able to step in. I work in a level 1 pediatric trauma center in both the emergency department and cardiovascular ICU, and learning to talk to the patients about how to cope and care, and quality of life has been a big thing, and I think that that is something that I strive to communicate to families with, and it has definitely shaped how I think that um, how I provide care, because it's not only about just getting them better, because sometimes that's not an option, but how can we do it most comfortably, or what are realistic expectations for your child, or when a child comes in cardiac arrest, not only putting lines in and doing all that, but it's taking a step back and looking at the family and really seeing that it's scary for everyone involved, and noticing how to communicate with that, I think is what makes nurses great and this profession great. Um, it provides there's so many different avenues that we can all go down, um, and try, whether it is pediatric, adult, and then with all of the specialties within it. But I think at the core of it is really providing evidence-based care as well as holistic care, while being an advocate for your patient. Thank you for watching, and thanks for letting these two be my little knuckleheads. Have a good day. Bye.